Welcome, everybody. Great to have you with us today. We are looking forward to talking to you about this fabulous resource that we've developed in Greater Manchester called the Dementia Care Pathway. And this pathway is intended to help you navigate, to support people affected by dementia, to find the services, support offers and different options available to people in and across Greater Manchester. So you'll be hearing from myself. My name's Helen Pratt. I'm a project manager with Dementia United. And alongside me presenting today is Cliff Wilson, who's a commissioning manager from Oldham, and also Sarah Fox, who's the project manager from Dementia United as well. So great to have you join us. This is going to be around 20 minutes recording, and we plan to have a bit of 10 minutes time or a bit longer if you require, just to have a go and navigate the pathway yourself. So that just to give you an idea as to the format of today. Alongside the recording, we have supplementary materials, and we'll make reference to those as we go through. So who are we in Dementia United? Well, we are the programme of quality improvement for Greater Manchester for people affected by dementia. Our aim is to improve the quality of life for people affected by dementia and for the staff supporting people affected by dementia. And in the image in this slide just gives you a little bit of an idea as to the approach we take to our programme of work in Dementia United. We have some 4 key priority areas highlighted, and also cross-cutting themes that underpin all of our work. But really at the heart of all of our work in Dementia United is ensuring that we work with and build on the networks, bringing partners, stakeholders, and actually ensuring that people with lived experience are at the heart of all of the work that we do. You'll see on this slide as well a link to our website. We'll send these slides out alongside this recording, so you'll be able to click into that. Okay, so let's go back to talking about the Dementia Care Pathway. How did it come about? Well, the work on this started 4 or 5 years ago, as you can see from this slide. And we started off with a real desire across Greater Manchester to improve the post-diagnostic support offer for people affected by dementia. And we started out looking at what those standards should be, involving people from a co-production point of view with lived experience in developing a paper format of the pathway. And then we took impetus from all the people that have been involved in the work on the pathway, who asked us to make this a digital resource, a web-based resource, a live resource, something that people could search and look at different boroughs to see what's on offer. And hence why we moved from a paper format to a digital format, which you can see today. So you can see on the screen. Just to let you know that in the Word document that we've provided, the supplementary material alongside this, we go into a lot more detail about the stages of this pathway and timeline. So how did we develop the standards that make the dementia pathway? So what was our approach? Well, there was, for those of you that were involved, and there was a lot of people involved in the early stages, there was a dementia assurance process undertaken quite early on after dementia was agreed as a priority in devolution. And that involved people getting together in the localities, meeting with a number of people from Greater Manchester's Health and Social Care Partnership to actually look at the gaps and variations in support services and also the best practice to see if we can make several recommendations and agree the programme of work. From that, over a 9-month period, we then looked at how do we use that gap analysis and agree the standards for Greater Manchester. And these were intended to be something that we would have as a working towards for us all. And we started off with around 100, in fact, it was probably at 120. And then with co-production, we were able to get down to 75 standards that currently within the pathway. And that was really down to 130 people living with dementia, families and carers, who were all involved in some of the pathway feedback workshops and also the survey in 2020. Some of the co-production, which has been so valuable to us throughout all of this journey, has enabled us to actually change the pathway, make sure that it was more meaningful, that the focus was what people with lived experience wanted. And this slide here highlights some of those examples. There was emphasis on time to diagnosis was really important, having the carer, having a much greater emphasis on the carer's needs and support for carers. And we had a digital user testing workshop in 2022, and that final bit in the slide slide there talks about the importance of information for crisis services, and that came from that. So it's been so important to have co-production all the way through the development of this resource. What was the goal with the pathway? Well, the pathway was intended to provide support to address the variation and fragmentation that people were describing in terms of accessing support leading up to diagnosis and afterwards. And the pathway, therefore, was to contain standards and recommended best practice to address that fragmentation. The pathway also was to include information on how each of the 10 boroughs of Greater Manchester were going to meet those standards. And those standards fell and follow the NHS England Dementia Well pathway from preventing right the way through to dying well. A little bit more now on the standards themselves. So, and I know I'm talking a lot at you at the moment, but you will get an opportunity when Sarah speaks to actually dive into and have a look at the pathway in more detail and see some of this in action. So the standards, so 75 standards were drawn together, as we said, and they are based on national guidelines and the things that people living with dementia and their care partners really wanted to have at the heart of the work we're doing in Greater Manchester. And to do that, we agreed that each of the standards would be given a priority status. And the priority status are 3 categories. 1, required to provide. So these are the standards in the pathway where there is very clear UK guidelines, legislation, for example, the Care Act. There might be NICE guidelines where there is a real requirement for those to be provided. For each standard where it's a should be provided, so for these, this is where there is UK guidelines, but there would perhaps not be a very clear requirement. But however, there would be sufficient evidence to suggest that these recommendations should be provided. And then finally, ambition. And it was really important to have the ambition in there because there will be standards that we're working towards in Greater Manchester where there's emerging evidence, perhaps where in Greater Manchester that we have been moving forward with best practice and we're wanting to roll that out across all of the 10 boroughs. So that's what the ambition sort of standard and priority status is. It's important to note at this stage that we don't expect all of the 10 boroughs of Greater Manchester to have provision against every standard, because as you can tell from me saying that some of these should be provided an ambition, they're things that we're working towards. However, where we are working towards some standards, if there is regional and national offers and evidence, we've made sure that that's included. So each standard, therefore, as I've mentioned, includes information on the standard itself, and in our supplementary information at the back of that document we've actually lifted all of the standards themselves. You can see them all under each of the stages: preventing well, diagnosing well, living well, and so on. So there's a standard, and then against each standard there's a person-centered narrative. That bit is really to enable somebody living with dementia and also somebody who's supporting somebody to see how that standard applies to them. How would it affect somebody living with dementia? So to try and make it more meaningful for somebody. And then alongside that information, there is the local offers. So there will be offers if they are available from each of the 10 boroughs of Greater Manchester. And you can go in and you can actually look at each of the 10 boroughs and compare against each other. And against each standard, there's also regional and national resources, as well as any evidence and best practice supporting those. And again, Sarah will be able to show you when we get into that, dipping into that practice bit. So I'm now going to hand over to Cliff, who's going to talk us through an example of how the pathway may benefit people in commissioning. Thank you, Cliff.
Thanks, Helen. Firstly, as a commissioner, the tool can be really useful when it comes to service mapping. All of the dementia services in your locality have been added to the tool. So this will give you an opportunity to have a look at what provisions are available locally. It'll also help with strategy development. As Helen's already explained, the standards were developed by engaging with people across all 10 localities. So this gives an idea and a starting block for any strategy development. We can also help identify best practice. So if you do have any gaps in your provision, we can look across all 10 localities and be able to identify services which will be able to help us learn. Also, it would help us support local services as well. Commissioners should be encouraging local services to actively use the tool to help find services for patients, but also to help service users to use the tool and give direction on it. And as we're going into an ICB, we are starting to do a lot more cross-locality work, and so it helps us identify services in different localities that we might not be familiar with. So now I'll hand over to Sarah, who's got some more examples for you.
Wonderful. Thank you so much, Cliff. So we're now going to have the opportunity to delve into the pathway resource itself and have a little bit of a look through there. And to do this, I'm going to use some specific scenarios. So scenarios where you might want to access a pathway to find something out. But obviously, these are only specific to these examples. And I'm sure many of you will think of other ways that you'll be using the pathway. But I hope this will give you a little bit of an idea of what it can be doing. So our first example could be thought of if you're someone who's looking at dementia. So maybe you're part who's supporting people affected by dementia. A scenario might be if you're an advisor and you're meeting someone living with dementia and they come to you and say they're really interested in knowing a bit more about local art groups and how they can stay social and meet new people. So if you're given this question, you might want to access the pathway. So here's our link. I'll just click on it here. Hopefully it will open. There we go. We'll always get a cookie consent coming up. I usually just accept, but that will come up most times you access the pathway. You'll see on our first page, we have a number of immediate kind of tabs that you can access. So crisis support, as Helen mentioned earlier, a little bit more about us, some frequently asked questions and how to get in touch. These little W's also change the size of the text on the page. So if you want text to be a little bit bigger, you can click that and you can visit our Twitter page. In our supplementary materials, we have a lot of information about how to navigate the pathway, so I won't go through absolutely everything while we're here. So if you scroll down, you have a search function, but you also have a map of where you live. If you want to look at services that are specifically available within your borough, you'll have to click on that, and that's when these services will come up. If you're more interested in evidence and best practice and national offers, then you can search on this main page. Again, this is explained a little bit more in our offline resources, which you're welcome to look through. But let's say we're a dementia advisor in Oldham and someone's asked us what arts and creative community groups are available. So we'll click on Oldham. We'll pop down to the bottom here. Now you can type in here, but also I always find this a little bit of fun. You can actually say what you want as well, and it'll come up in the search. So if I click this little microphone, by the way, I've not tried this when we're experimenting beforehand, so I hope this will actually work. If it doesn't, I'll just type. It should work though. Arts. Oh, I have to allow it first. You can see how well it works. It picks up exactly what I'm saying. I'm just going to type it in, but you can see the microphone works. So when you click in arts and search, we've got a few different recommendations that mention arts. So maybe look at this last one. Arts and creative therapies are to be available to people experiencing cognitive decline. So we go on to this. We can see instantly that it's an ambition. So there's significant evidence that suggests this might be beneficial, but it's not required. What's really interesting and what you get here is local offerings and local activity groups. We've got Hope Chapel here, which has music, quizzes, and light-hearted good fun. Sounds good. And a number of other offers here as well. So if you've got someone who's looking for something available in their area, you might find something here. What you can also do is if you button, it'll download you a PDF. I'm not going to do it right now because it takes a little bit of time, but definitely try it in your own time, or you can immediately print it. So you can download the PDF and print it, or you can just click the print button and you can set it up to come out your printer, and then hand this to people sitting in front of you, and you can maybe highlight the activities that are really important. I quite like this as well, because let's say someone maybe doesn't have access to the internet or computers at their own home. You've got an address here, and we've got a phone number as well for a lot of these activities. You might not share with, or you might want to share with the people, is you've got some regional offerings as well. This is not local, across the whole of Greater Manchester. Again, some of these are websites, some of them aren't, and national offerings as well. More of the regional nationals will take you to websites, so a bit harder for digital exclusion. But you also have at the bottom here a list of evidence. So this is so important, so quite nicely written with, again, some links to important evidence and best practice. So you get a lot of information there, and I hope you can see how that might be able to help you if you're supporting someone living with dementia. So just to quickly pop back to our slideshow, I've got another example. So let's say that you're looking to add a new service. So you work in a service and you want to add some scenario, you're a GP and you're looking to audit your health check protocol. Maybe you want to add dementia screening before the pathway. There we go. And we'll pop in here. We'll use this main page because we're not looking locally here. We're looking more for evidence and best practice. So we'll put in already, you can see I've been trying this previously, pop in health check. Yeah, dementia screening will be offered as part of your NHS health checks and will be specifically documented. So again, we've got a little bit of information and we've got some offers that you might be able to bring in. So Dementia United developed a brain health leaflet, which you can download and give to people. Got some brain friendly recipes, but then also you have our national offerings here. So this is helping your brain stay healthy, the dementia component of the NHS health check. There's a lot of information in this link. You also have a lot of evidence, which again will take you to other third-party sites which contain useful information and best practice resources. And once again, you can download and you can print this, and the priority level of this one sits at being a should. So quickly popping back to our PowerPoint and our next example. So this one's a little bit different. You'll probably be able to see by the way I used the first example that if you're someone living with dementia or a care partner, you can, of course, use the website exactly like I just did, so popping into Oldham and writing arts. But if you're either living with dementia or caring for someone living with dementia and you're not really sure which recommendations interest you, but you want to see a selection that might be of use, what you can do is you can pop onto our little survey. Now, let's pop onto here again. So our survey, we have an immediate question. Are you someone living with dementia or are you caring for someone living with dementia? Let's click we're caring for someone living with dementia. And then we ask, what would you like support with? So maintaining brain health, receiving a diagnosis, living and supporting, or dying well. So let's click dying well. And this now brings up all of the recommendations that cover dying well. So we've got a GP should maintain a active care register for those in the last 12 months of life. Out of area placement is an important one, and safeguarding, and all of these you can pop in, learn more, download or print. So this is just another way to access the pathway. So next section is contacting us. So this is a living website. This is something that we're constantly updating and keeping on top of. So as you probably know, services chop and change and come and go, and especially in the current keen, if you ever want to reach out and say something's out of date or I have a new service that I'd like you to add to the resource, you can just click this little button at the top that I've highlighted here and drop us a message and we'll get back to you as soon as we can. So we're now going to give you 10 minutes to try this out yourself. So at this point, we're going to pause the presentation. You can either go in there and just have a look for things you might be interested in, but if you want a little bit of a steer, we've got a couple you might want to have a go at as well. So imagine working with a service user who wants to join or do an activity in Bolton, so you can find out what groups are available for us. Or maybe someone wants to know their rights as a carer when they're visiting their loved one in hospital. Can you download this information from the pathway? I know you can, it's there, but can you? And you're asked about how the pathway is updated and how often this happens. Can you find that information in the pathway? So there are a few little tasks you can go and have a go at, or you can try it yourself. So we're going to pause the video here.
Welcome back, everybody. Hopefully you've all had a go at either answering the questions that we've put or just been able to navigate and have a look through and find some of the examples of things that would be useful to you in your practice and your day-to-day work. So as Sarah said, it's a live resource. It's a working resource. We're really keen to hear from you. Let us know if there's anything that's missing that you know about in your locality or borough, or also if there's aspects of the standard and the evidence and best practice that we can be updating. So what's our ask of you now? Well, hopefully you'll have found this recording very useful. and you will be able to use the slides alongside this recording and also the supplementary information that we'll be sharing with you. But there's also a number of flyers. You can direct people to the Dementia United website and the Pathway website. You can print off the flyers, be handing them out, promoting them, having them on a table end, or just having lots of different ways of talking about the pathway and sharing it. We really would like you to promote and embed the use of the pathway. So that just leaves us really to say thank you very much for listening to us today. Hopefully this has been of value to you. Do get in touch. Let us know how valuable the pathway is or isn't. Is there anything that we can be changing within it? And if you'd welcome any other information or support. So that's our Dementia United website. So please do get in touch. We look forward to hearing from you. Many thanks, everybody.
Thank you.
Thank you.
Bye.